All right, welcome back to another Diabetes Canada webinar. Today, I'm very excited. We have a webinar for healthcare providers on hearing and diabetes. And I'm excited to introduce our speaker, Christine Meston. She's a faculty member in the School of Communication Sciences and Disorders at Western University, a registered audiologist with extensive experiences across hospital, private practice, and educational settings. Christine integrates her practical knowledge into her teaching, research, and clinical work as a clinical educator for the Master of Audiology program at Western's H.A. Leeper Speech and Hearing Clinic. She primarily manages pediatric cases, providing diagnostic and amplification services through the Ontario Infant Hearing Program for children identified with hearing loss. Her previous research has investigated adolescent self-management in hearing healthcare, and she has collaborated on developing clinical practice guidelines for virtual hearing aid care. And in 2024, Christine and her colleagues received the Canadian Academic of Audiology Clinical Research Grant to support their work on optimizing hearing health for children with diabetes. So without further ado, I'll pass it over to you, Christine.
Hi there. So yes, today my first in the three-part series is going to be looking at diabetes as a risk factor for hearing loss. So I'd like first to acknowledge the rest of our research group, Dr. Danielle Glista and Dr. Chris Allen, our research assistants, Jana and Polisa, and also, of course, to acknowledge the Canadian Academy of Audiology for awarding our group the clinical research grant to fund our work. We know that diabetes is a risk factor for sensorineural hearing loss, and a sensorineural hearing loss is caused from damage or deterioration of the structures in the cochlea, which is our organ of hearing, or to the auditory nerve that sends signals to our brain. So I have here up for you a picture of our ear, and it's divided into three parts. So we know that diabetes is a risk factor for sensorineural hearing loss, and a sensorineural hearing loss is caused from damage or deterioration of the structures in the cochlea, which is our organ of hearing, or to the auditory nerve that sends signals to our brain. I have here a picture for you of our ear, and it's divided into three parts: the outer, right here, the middle, and the inner ear. So our outer ear, where I've highlighted here with the red bracket, is comprised of the part of the ear that you can see on the outside of our head, so the pinna. It's also made up of the external auditory canal here with the blue arrow, and it's pointing to our eardrum or the tympanic membrane right here. And so sound is collected by our pinna. It travels down our ear canal to the eardrum that vibrates, and it converts that auditory signal to mechanical energy. So this leads us to the middle ear, which I've circled here in red. And the middle ear is comprised of the bones of the middle ear. And those are, or the ossicles, we also call them, and those are called the malleus, the incus, and the stapes. And sound is transmitted across the bones of the middle ear to the inner ear. And our inner ear is comprised of our organ of hearing, which is the cochlea, and this is this little snail-shaped structure right here. And it also has our balance system or our vestibular system, and that's made up of the semicircular canals, which are tucked back in here. But we're going to be concerned with our hearing system today. And so the cochlea, it converts that mechanical energy from the middle ear into an electrical signal that is sent onto the brain by our auditory nerve, which is over here. So if there is damage to the inner ear, it can cause a permanent sensory neural hearing loss. If there are issues with the outer or middle ear, so the outer ear here or the middle ear over here, it can result in a conductive hearing loss, which can often be treated medically and can often not be permanent. Whereas if there's that damage to that inner ear, it can typically result in a permanent hearing loss. So some of the common causes to damage to that inner ear, to the cochlea, can be aging. So as we get older, we have deterioration of the cochlea that can cause a hearing loss. Genetic, so we can be born with a hearing loss or have inherited a condition that predisposes us to hearing loss later in life. Sensory neural hearing loss can also be caused by noise exposure. So if we've been exposed to loud noises, that can damage our cochlea. So for example, if we've had really noisy jobs, we worked in factory or industry or farming, or if we've gone to too many loud concerts, that cumulative exposure over time can cause damage to our cochlea and lead to a hearing loss. There are also drugs that are toxic to hearing. So often those are life-saving medications, and that physicians know the risk factor for hearing loss, but that can cause sensorineural hearing loss as well. And of course, there are illnesses or chronic health conditions like diabetes that can also lead to a permanent hearing loss. So that relationship between hearing loss and diabetes is really complex, and there's ongoing research to look at those specific causes of hearing loss. However, complications that are often discussed with regards to diabetes due to high glucose levels, so things like decreased blood flow, decreased oxygen exchange, or decreased ion transport, can affect those sensory and supporting cells of the cochlea. So we have some really, the cells and vessels in the cochlea are really, really delicate, and if they are damaged, they can lead to a hearing loss. So there's different mechanisms where that damage can occur. So it's thought that if there's damage to the sensory cells, so there's called hair cells, then they help to convert that mechanical energy to an electrical signal. If those are damaged, then it can lead to a hearing loss. If there is damage to the blood vessels in the cochlea, so the vessels that supply or provide that blood supply to the cochlea, if they're damaged, it can lead to a permanent hearing loss. Or it can cause damage to the nerve itself that allows those auditory signals to be sent to the brain. So most often, diabetes is associated with a high frequency hearing loss that can progress over time. So this means an individual could start out with hearing that's normal, and then it can slowly deteriorate over time. And with that deterioration or that hearing loss happening in the high pitches or for those high frequency sounds first. So what I'm showing you here is an individual's hearing test result who has a high frequency hearing loss. So across the top, we have various pitches from low pitch sounds all the way to high pitch sounds. And down the side is how loud a sound had to be played for an individual to hear it. Can it be really, really soft, or does it have to be quite loud? So all the way down here at the bottom. And the X's and O's along here represents an individual's hearing thresholds for the right and left ears, or the softest sounds that they can hear. So compared to someone like myself who has typical hearing, my hearing test results would all fall in this green shaded area. So all my X's and O's would be across here, where you can see for this individual who has a high frequency hearing loss, some of their test results fall outside of that green shaded area. So in this case, you can see they have some normal hearing right here for the low pitch sounds. And as I said, some of those test results fall outside of that green shaded area. And in this case, they have a hearing loss for those high pitched or high frequency sounds. So this person may start out having some difficulty hearing. They may notice that they hear some sounds really well, but in some situations they're having more difficulty. And that's because for this type of hearing loss, they can hear all these sounds circled in green fairly well, but they're missing some of these sounds here circled in orange. And some of these sounds are really important, especially for speech and language. So we have these really soft consonants, and we start to miss those. It might sound like people are not speaking clearly or that they're mumbling. So individuals with diabetes are more likely to develop a hearing loss than those without diabetes, and that hearing loss may present at an earlier age compared to those without diabetes. And diabetes may be linked to greater hearing loss severity as well compared to those who don't have diabetes. And there's also some evidence of sudden sensorineural hearing losses. So those are individuals who may have a normal hearing and it drops suddenly. But more typically, we see that high frequency hearing loss that progresses over time. And diabetes may also increase the risk for hearing loss due to noise exposure or ototoxic drugs. So earlier I mentioned that we're all at risk for hearing loss from those exposures, but individuals with diabetes may have an increased risk for those exposures. So for example, we may recommend for someone with diabetes to be more diligent in wearing hearing protection when they're maybe mowing the lawn or going to a loud concert. However, it is suggested that well-managed diabetes may be able to mitigate the risks of hearing loss. So the key messages for this webinar are that individuals with diabetes are at a higher risk of developing hearing loss over time. It may present earlier in life and present as a high-frequency hearing loss first. However, it is possible that with well-managed diabetes, we may be able to reduce the risk of hearing loss, or if there is a hearing loss, to reduce the severity of that hearing loss. Thank you.